So we're going to talk here about the kinematics of contraction. And we're talking about kinematics of contraction. We're talking about what happens to the muscle hull within the contraction cycle. And so the first way we can talk about the contraction is by the length that the muscle takes during the contraction, in which we could talk about it being isometric. In isometric, there is no visible movement to the muscle. The start length and the end length of the muscle gaster does not change. Concentric. In concentric, we have movement of the muscle that will shorten the muscle by shortening the sarcomere, which means that the end point of the muscle is going to be proximally closer than the start point of the muscle. And then lastly, we have eccentric. In eccentric, we have movement of the muscle where the muscle is lengthening in terms of the sarcomere lengthening, in which the end point is further distal than the start point, or the start point is proximal to the end point. In this, we can throw together all of the contractions looking at the change of length relative to the change of time in what's referred to as the contraction cycle, in which during most contraction cycles for movement, we will have some sort of concentric, isometric, and eccentric muscle function within the overall movement pattern that we see. The other way that we can talk about muscle contraction is based off of the load that's being applied and the muscle's ability to overcome that load. If load is greater than tone, the ability for contraction strength, we will have an eccentric contraction. If load is equal to tone ability, we will have isometric contraction. If load is less than recruited contract tonicity, we will have concentric. And so if you think about it, if we are trying to move something that is less than what we are able to move, we obviously can shorten the length of the muscle. If we're trying to move something that is heavier than what the muscle can be recruited to do, the muscle will obviously lengthen. If you think about this, try holding your hands up at a bent elbow of about 90 degrees, and then slowly start loading books into your hands. And what you'll notice is that your hands will start to bobble as the weight gets applied to it, but you're holding the isometric hold. When books get put into it, the lowering point is the eccentric. The rising point is the concentric, because you're changing the level of tone within the muscle based off of the load that you're attempting to resist. We can also discuss this based off of the speed of contraction. And when we're talking about speed of contraction, we're talking about the direction that I want to move. Because remember, velocity is a vector, in which isometric has no velocity to it because there's no change of distance. Concentric has increasing velocity because I'm moving in the direction I want to move. Eccentric has decreasing velocity because I'm moving in the opposite direction that I want to move. And so if we put these all together, we get what is referred to as a force velocity curve, where the slower I move, the more strength I have. The faster I move, the less strength I have, the less force I can develop within that contraction based off of the relative ability of the muscle. Where if I am meeting the ability of the muscle, I will have no velocity whatsoever, and therefore have no motion, and therefore have no velocity. The other component that comes into play here is what's referred to as the length-tension relationship. And the length-tension relationship is an indication of how much strength I can get relative to the length of the muscle. And we have a typical range of maximal strength. And that typical range of maximal strength is about plus or minus 30% of the resting length of the muscle. In which, if I lengthen the muscle, eccentrically lengthen, I start to diminish the amount of interactions that I have with and between actin and myosin. However, if I excessively contract the muscle, concentric, I start having diminishing interactions due to overlap between the actin and the myosin. The actin molecule will actually start to interact with each other in such a way as to inhibit the ability for myosin to interact. And so we can actually look at this in terms of the filaments that come into play as it relates to the contraction cycle going on, in which I start with my relaxed fiber. I then get the signal to contract, and what's happening is that the myosin will start to pull on the actin, pulling the actin towards each other. And then I will get to the full contraction, at which point in time the actin will start to interact with each other on opposing ends of the myosin proteins, diminishing the number of interactions I can have in between the two proteins. We can throw all of together to look at how does the three types of contractions lead to either the change of force, the change of velocity, or the change of distance, where we have a larger force capacity on the isometric and eccentric side than we have on the concentric side. But we have a faster contraction taking place on the concentric side than we have on the eccentric side. There's one other component that comes into play in terms of the kinematics of the muscle contraction that we have to look at. And that other issues that we have to look at are the issues of preload and the issues of the cross-sectional area of the muscle. Preload is the indication that if I stretch a muscle prior to causing it to contract, I'm able to store potential energy within the tendon that will passively be returned to the muscle during the active contraction. The more I use the muscle, the more collagen will be placed within the tendon, providing for a more rigid tendon, and thereby increasing the potential energy within the tendon for the contraction. You can think about this setup by attempting to jump from the floor. If you jump from the floor straight-legged, it's very hard to actually jump. However, as you squat slightly, you start to stretch the muscles that are involved with the triple extension to allow you to jump. As you stretch those muscles, we preload the tendinous unit. And as we preload the tendinous unit, we now store potential energy that upon contraction of the muscle allows the muscle to exert additional force and provide additional strength for contraction to give more power output necessary to, say, jump off the floor. We use this preloading to our advantage in locomotion. Running is actually, muscle energetically wise, more efficient means of moving at higher speed than walking, because I get additional energy return for every foot strike that I get. However, if I try to decelerate that running, where instead of running on the midpoint of the foot, I try to land on the heel and then roll onto my hallux to push off, I actually inhibit the preloading to take place, and I utilize excessive eccentric load, excessive braking, which is a highly energetically taxing form of contraction because I'm working past the potential that the muscle happens to have. The last thing that we have to look at here is the relationship between the cross-sectional area and the amount of force and strength that develops within the muscle. Part of this relationship has to deal with the relationship of strength, where as I increase my cross-sectional area, I increase the load that it takes before I have tensile damage to the muscle, meaning that I increase the load based off the increase of the cross-sectional area of the fiber. The other thing that happens is that I'm able to get more cross bridges within the muscle. If I'm able to get more cross bridges within the muscle, I'm able to have more points of interaction between the actin and the myosin. And we have to think about this interactions like someone trying to row a rowboat, where yes, one person can row a boat, but if I have two people each rowing, I become more efficient in my rowing. I can produce more force and move the boat faster. If I have three people, even faster. If I have four people, even faster. If I have five people, even faster. So on and so forth. The more cross bridges that become available, the more force can be generated and the more strength that I will see as a resultant of those cross bridges. So the increase of cross-sectional area passively will increase the level of load that can be taken before I have damage to the muscle, and then actively allows for more cross bridges to take place within the contraction, thereby providing more kinematic energy to the contraction and thereby allowing for faster and stronger movements to take place.